actually really hard to believe. Flu cases in Arizona are up 793% over this time last year. And the peak of Arizona's flu season, that is still a month away.
Yet the likelihood that you are or have already been sick is really high. The flu is widespread in Arizona, among the sickest states in the country.
In fact, just tonight we learned that we lost 8 people because of the flu in Pinal County.
ABC 15's Katie Connor joining us from 24th Street in Roosevelt. And Katie, there are concerns about the treatment being available to help people.
Yeah, which is making this even more concerning because we've seen people just flooding into emergency rooms just like this one behind me, just asking for help. But we're learning that's becoming even harder because of a shortage.
Dr. Giovanni Michelli is usually the one helping people feel better, but this year he's on the other side.
I started with a sore throat, with some congestion and drainage.
Even though Michelli wasn't sure if he had the flu, he did not want to take Tamiflu, the antiviral medication that treats flu symptoms. It can shorten how long you're sick. But he knows Tamiflu is in high demand and
we don't have a lot of it, so we want to reserve it for people that are at high risk for infections.
Doctors across the valley echoing Dr. Michelli's words. There's not enough Tamiflu to go around.
Patients will go to various pharmacies and they find out they can't pick it up, and they'll often have to wait 1 to 2 days to actually get Tamiflu, which is a problem because Tamiflu is most effective within 48 hours of getting flu symptoms.
Dr. Natasha Bouillon thinks the shortage is twofold. There's been a spike in flu cases, and second, this year's flu shot isn't as effective because there is more than one strain of the illness going around, one more severe than the other.
So as doctors, we have to distinguish who really needs this medication and who doesn't because there is a shortage. So we know that people who get the flu who have things like asthma or COPD or other lung diseases, they're at higher risk, so they really should get Tamiflu.
For those who don't fit that criteria, stay home until you're feeling better. And just remember, it might take a little longer than normal.
Usually when I get sick for like, a couple, 2 to 3 days, and then it's done. This year it's just for some reason lingering a little bit.
Back out here live, we did reach out to Tamiflu, who says they do have a robust supply of all of this medicine. They actually work with the CDC before the flu season to make sure they are prepared. But Stephanie, sometimes they did say there are spot shortages, which is what we're seeing right now. And that's because, Stephanie, we've just seen a huge spike in these flu cases. So they're working on getting medication to all the pharmacies here.
That's unbelievable. Someone on my Facebook page even said that they've had the flu and symptoms of it for 14 days. I couldn't believe it. It's unbelievable. Katie, thank you.